Great. Thank you so much. What a pleasure to be here. Be careful if you do introduce yourself to me, because I will get you into the work. That's what I'm all about that collective approach and making sure that everyone is a part of the change we want to see at City. So as Corinna has said, I am the Assistant Vice President of Quality, Diversity, and Inclusion here at City University of London. I'm also a reader in psychology. I'm also a proud counseling psychologist, trained in the US, and I have spent many years working directly with university students in a clinical environment, empowering them, encouraging them to flourish and to thrive in their academic setting. So for me, I have a lot of skin in the game with regards to what we can do to improve our students' journey as they embark in their studies here at City. So I'm also very proud that I get the pleasure of kicking off the afternoon talks. I know you've just had a full belly of food and probably will nod off in a little bit, but hopefully my intensity, my energy will keep you up and bright, and if I don't, you can leave. So for me, it's really about supporting and improving student mental health here at City, as I've said. And I'd also like to take the opportunity to thank our mental health team, our counseling team here, our leaders in this area, because without you, we would have not survived this crisis of the last 2 years. You are fundamental to what we do and how we do for our students here at City. I'm also going to thank the student leaders who have been responsible, who have been able to engage and step in this space where it's been so difficult, and representing those voices that really needed to be heard. So for those of you who have been in that space, thank you. So let me go ahead and get started. And what I'm really excited to also share is this new approach that we're taking here at City, which is holistic and intersectional in supporting and improving the mental health of our students. Okay, so equity, inclusion, and justice has been cornerstones, core values here at City. They have been principles that have been leading the way in the way that we do our work here at City. Our path really hasn't been easy, and there are areas where we still need to improve. In particular, the outbreak of COVID-19 has tested us, our systems, our response levels, and our ability to engage in this really critical area. And it has had an unprecedented burden on our students, evidencing higher levels of stress, anxiety, and depression. I'm sure you've heard this already before. And with 83% expressing worsening pre-existing mental health conditions, with rises in isolation and induced loneliness, which is recognized as a suicide risk or suicidal risk. In addition to the presence of the pandemic, students with protected characteristics, mainly ethnic minorities such as Black and minority ethnic students, as well as sexual and gender identity students of the LGBTQ community, are further impacted negatively with regard to student mental health well-being and the sense of belonging. In university, belonging concerns sap motivation, and they contribute to inequality in achievement and their life successes. The statistics and outcomes around this remain too stark, and whilst the proportion of BAME students and LGBTQ students continues to grow at City, there's still so much more to do. And so as a result, we have embarked as an institution on a journey to address our shortcomings and to interrogate our student experience and our support services for our students at large. Sorry, oops, here we go. So I hope that this diagram represents kind of this journey that we've been on from inclusion to intersectional approaches. With regards to inclusion in higher education, it's an ongoing transformative process of improving education systems to meet everyone's needs, especially those from marginalized groups. And what does inclusion mean? Well, within higher education, it means the action, practice, or policy of including any person in activities, system, organizations, or processes, irrespective of race, gender, religion, age, ability, or etc. Whilst inclusion can be defined both narrow and in broad terms, it's about reaching out to all types of learners, as well as those with specific needs. A narrow definition would potentially focus on the inclusion of a specific group of people, whereas broad view of the practice would look at inclusivity of the whole institution in itself. So in creating an inclusive educational system involves not only creating the conditions for inclusivity to thrive, But it's also through the curriculum, the architect, what we see around us, as well as accessibility concerns that we need to be mindful of. But it is also about actively challenging the reproduction of inequities. It's a way of working to a more open, fair education landscape, as well as towards social justice for historically disadvantaged groups. So that's what we've been doing kind of over the past 5 years. Most recently, in the advent of the murder of George Floyd, we have moved forward to a transformative approach. And at City, our journey has been reflecting on how we might deliver for an inclusive curriculum and creating inclusive spaces. The next stage of this journey will move from an inclusive to a transformative approach, which is a collective process, meaning that we bring all of us together, our students, our staff members, our leaders, in order to share in this endeavor, to empower ourselves, to provide greater understanding of the impact of social, political, and economic contexts that create disproportionate inequalities, and a desire to work towards changing those inequalities for all of us, both staff and students within. Now, our journey towards taking a more intersectional approach will lead us to recognizing that representation matters. If you look around the room and look at sort of kind of the hierarchy here at the institution, you will note that there is a lack of diversity within our within our academic leaders. And that's fine, but when we are trying to fix for a more diverse lens, we need to have that diversity of thought, that diversity of experiences to lend us those solutions that will address those intersectional and inequitable problems. We are also co-producing with students. The co-production of the student body along with leaders is essential and critical for us to get it right the first time. Because by overshadowing the voices of our students, we miss a trick. We really miss an opportunity there. We're also reviewing our university policies and practices for how inclusive they are in meeting the service needs of all our students, so that they do no harm and they don't further alienate our students from their experiences here within the institution. We're also creating safe spaces for students to explore their self-identity. This is a momentous time for students who come to us during this life stage. They are making choices, they are making decisions, they are being informed, they are being challenged, and they are also being transformed through the experiences and their interactions with each other and with us as people responsible for that educational experience. So it's important for us to provide them that safety for their experience to thrive. And lastly, we're developing resources and peer advocacy programs that will empower students to nurture their own resilience, whilst at the same time engaging them in supporting others. So we have heard a lot about peer-to-peer responsibility, the ways in which we can empower and grow the resiliency of our students, and also tap into already existing resiliency. Is everybody still with me? Yeah, all right, you're not nodding off yet. Great, perfect. So many institutions, including City, have initiated work seeking to take on an inclusive approach. So that is kind of basically what we've been doing over the last 5 years. We have been doing this to improve student progress and success, and have sought to improve uptake of support and developmental opportunities for specific student groups, targeted at promoting their well-being as well as their mental health. We've introduced specific initiatives for Black and BAME students, such as working with role models within the alumni community or specific mentoring programs. To date, City has focused its efforts on work supporting students from widening participation backgrounds who are underrepresented in higher education and face specific challenges, as well as how they access and succeed in the university context. So these targeted groups for widening participation include mature students, care leavers, socioeconomic background, with all high proportion of Black students within these groups. And these are some of the examples that we have here already at hand at City, which include City Cares, professional mentoring, City Buddies, our mental health counseling team, as well as the learning support and personal tutoring. And forgive me if I didn't include everyone or everything that we do have here on offer, but these definitely have been making some waves. In fact, our City Cares just recently received a NEON award for the work that they've been doing. So I just wanted to kind of toot that horn there for you all to know. Okay. So towards a transformative approach, an inclusive approach is not necessarily one that is transformative. A transformative approach would be to move from a position of being to a position of doing, of acting, of engaging. So it's that kind of movement that we want to see. We have adapted a transformative approach, which is defined as one that understands social constructions of race and gender, challenges the values, structures, and behaviors that perpetuate systemic racism and other forms of societal oppression within and outside of our institution. We at City have begun the process of opening conversations and doing the work. This has required us to be brave, intentional, values-led in our language and our conversation. It has required us to continuously develop and be innovative in our delivery of targeted, inclusive initiatives. This has required us to listen, to actively learn, and be action-oriented by remaining agile and flexible on an organizational and individual level. And lastly, it has required us to build and nurture committed and accountable strategic partnerships and centering underrepresented voices of our student body. So in the first part of building language and conversation that's brave, intentional, and evolving, this has required us to reframe the way we talk about mental health and encourage students and staff to use alternative and sensitive language around this construct. We have also mindfully and strategically had difficult educational conversations. Where is it that we learn about mental health? When is it that we introduce our students around the mental health experiences that they might have here? And this is followed by action and support, especially with leaders around terminology and stigma related to its challenges. We've also had to challenge and push back assertively yet compassionately, internally and strategically uplifting and centering the voices of our students. We are student-centered. We prioritize our student in everything we do and everything we must do. This is also has required us to be committed and accountable through strategic partnerships. And in considering issues of inclusion, we move towards making a more proactive and transformative approach. We see taking an intersectional approach as deepening those efforts. We have spent a lot of time reflecting on our core institutional values recently and how they shape our inclusive and culturally competent behaviors, as well as the environment around us. As a university, we're committed to diversity, equity, and inclusion, at the same time as being committed to mental health and well-being. Both are underpinned by our emerging strategic vision, being led by our university president, Professor Anthony Finkelstein, and our approaches of a curriculum, our staffing, our policies, and all of our practices should be influenced by this new approach that we're taking. This intersectional approach, who we are and how we feel about ourselves and each other, our awareness of our place in the world as global citizens, will create a sense of belonging for both our staff and our student communities. But in order to do this, we must do a number of things. Firstly, we have to build for the intersect between race and sexual identity, orientation, and mental health into how we do, say, and believe we are. We also need to use the mental health charter, which I will talk about in a few slides, as a platform for action. We must prioritize close working with our staff and students of color and other minoritized backgrounds, centering their needs. We must engage and support targeted staff and student lived experience and understand what puts them off from accessing our mental health services. Continuously put student leaders and representatives and SU leaders in control of student work and empower them to lead, bring them to the table, give them a space. And lastly, we must work with our senior leaders, particularly our senior diversity ambassador, around mental health and well-being. And I will explain a little bit about that pan-institutional initiative that we are ready to launch in a few days. Great, so this will be about our next steps as an institution and what we'll do now. But again, this is not all-encompassing. This isn't representing everything that we're doing, but this is really kind of highlighting some of the key areas that we want to really focus on as an institution. Oops. Did I go on? There we go. So, as I mentioned, and maybe some of you might know the charity Student Minds, they have created a university mental health charter, which City will join. And as an institution, we'll commit to adopting a whole university approach to mental health and become a place of promotion that promotes mental health and well-being of all its members in the university community. And the evidence clearly shows that our environment is a key determinant of mental health, physical, culture, social, and personal. And therefore, we will adopt the University Mental Health Charter that will enable us to provide an evidence-informed framework, as well as share practice and improve our approaches by learning through others. And lastly, by gaining accreditation, by building an evidence base of excellent practice. So we want to do the best we can, and we will use the Mental Health Charter to guide us in that path. So according to the Charter, a whole university approach must include both adequately resourced, effective and accessible mental health services and proactive interventions. So as a part of our strategic undertakings, we are investing in this resource. We are prioritizing the investment so that we can continue to allow our students to thrive. But it also must provide an environment and culture that reduces poor mental health, as well as supporting good mental health and facilitating staff and students to develop insight, understanding, and skills to manage and maintain their own well-being. So again, this is about inclusive, transformative, and intersectional approach that will require us all to step in together. So we are ready to launch our Senior Diversity Ambassador Scheme. This is an initiative that has been supported and initiated by our university president. I support him and his senior leadership team as my role as an assistant vice president of EDI. There are 8 senior diversity ambassadors who will represent and champion 8 areas, mainly those of protected characteristics. But because mental health and well-being is such a vital area of concern, but as well as how we want to do better as an institution, we have now have a mental health and well-being ambassador. And this is Professor Deborah Salmon, who is currently the Dean of the School of Psychological and Health Sciences, or Health and Psychological Sciences, as well as the interim deputy president of the institution. And I just wanted to kind of leave you with her quote saying, as a public health professional, I am committed to a strengths-based approach that focuses on building the student community and social connectedness in order to enhance students' well-being and learning, while at the same time providing the appropriate services for those in need of more personalized support. I understand the importance of bringing teams together in a shared vision to deliver on this and feel passionately about being part of that multidisciplinary approach. So her, along with our other 7 senior diversity ambassadors, will champion, will act with authority in order to elevate those voices of those with concerns around their experiences here at City. And we're very excited to have them do this over the next couple of days to introduce themselves in these new roles. So this is just sort of pre-launch promotion. Another aspect that we're also focusing on is how can we commit to including our students in this journey. And I just wanted to kind of highlight an emerging practice that we have started here at City called the Counseling, Psychology, Therapy, and Research Clinic. This clinic is housed within the Department of Psychology, which is headed by Dr. Trudy Edgington and other colleagues within the professional doctorate of counseling psychology. And this is very much a training model that is used in the States, one that I was trained under, as far as allowing students within the psychology department to provide psychological support for university students in their roles as trainees. So this enables that modeling, that role modeling, as well as that support in which we provide students with those opportunities for professional development and growth. Another aspect of this clinic is the research side of it, where we want to understand and appreciate the impact we're having on providing psychological care for our students. And so we will conduct robust psychological studies within that clinic in order to understand the student experience, but also improve our practices and ensure they're having a bang for their buck. So that's really exciting developments there, and we are looking forward to seeing that grow, as well as incorporate itself and embed itself within the institutional structures. So before I close on this particular lecture, I just want to kind of leave you with some of the challenges and lessons that we have learned over the last few years, and particularly in the highlight of the pandemic. Some of the things that we really had to face and look into the mirror and see as an institution, but more specifically as leaders within the institution providing robust intersectional care. First is our lack of understanding and appreciation for cultural competency, understanding who our students are, the particular experiences that they face, and the challenges that they have within this institutional context, and how it impacts their identity and their sense of belonging. Also, the lack of representation in critical leadership roles and strategic conversations was lacking. And so we have made an effort to really address that through creating those spaces, those safe spaces where we can start those conversations. There was also a surface level engagement, and I don't mean that in a very disparaging way. I'm just saying that sometimes we just missed the boat, or we missed that opportunity, or we were too slow to react. So there was, and that's because of siloed working as well as capacity constraints. I mean, the pandemic was a shit show for everyone, right? We all suffered. I mean, there isn't one person who got out of that unscathed. But we really needed to kind of reflect on what kind of energy we needed in order to make this type of massive change, and really needed to be honest with ourselves. We also needed to define mental health and its appreciation for intersectional thinking, and understanding that there are particular groups, vulnerable groups, as well as groups who had no idea that their mental health is impacting on their progress, their success here at City, but in their lives forward. So some of the lessons that we have learned and some of the things that we have taken into consideration is centering underrepresented voices and empowering them in safe spaces. Also, pacing is important because we don't want to burn out. We don't want to get over enthusiastic and not have enough energy to kind of finish the job. So we needed to ensure that we were creating sustainable work that sticks, as well as reconceptualizing what allyship means in these spaces where perhaps underrepresentation is. So we need to bring everybody in. How can we do that? We also needed to interrogate our processes and enable a collective consensus. And that means being honest with ourselves and having those opportunities to reflect, not just with ourselves and being an echo chamber, but with our students. If we're really going to center on our students and their experiences, we need to bring them in the room, and we need to have them have a seat at the table. We also need to encourage our leaders to be courageous and to hear those lived experiences. And conferences like this one enable us to do that. I am sure that several experiences might have been shared, or research that has been motivated or inspired some of the research questions that we probably have seen out in the posters outside. And then lastly, we need to enable psychological safety. And that is utmost important for our ability to succeed and to bring out an intersectional thinking and practice. And that is all I have for you today. So thank you so much.
Fantastic. Thank you very much. I'm overwhelmed with all the initiatives coming our way. I think that's you, Jessica. Are there any questions?
Firstly, what we've learned is that mental health or anything around sort of well-being doesn't exist in all languages. That's one thing to say. We have a very diverse student body, one that comes from many countries, I think over 150 countries across the globe. And not all of them have English as their native language. And so therefore, even talking about mental health is a foreign concept. So that's kind of the first place in that. But also mental health, mentally ill, crazy, all of these different types of languages can be construed as insensitive. So we need to think about how we use those languages and how we introduce these concepts in a way that's sensitive and competent, but also really respects the individual lived experiences of those who are living with any kind of mental health conditions. So that's one way that we've been trying to kind of create this space. There's also the sense of stigmatization as well, in the sense of what it means to have this label, to live and work or study with this construct over your head. So we needed to be mindful and sensitive to that as well.
Brilliant. Thank you. How did you get involved? How come you do this?
Oh, I have a fantastic EDI team. I think you can contact them at edi@cis.ac.uk. Anything that you want to do, they will be happy to help support or to actively deliver on their behalf.
Great, because obviously it'd be fantastic to kind of work out how we can figure this down to our sort of more local initiatives. Thank you so much. Are there any further questions?
Yeah, one quick one. First of all, sorry I came in late. I was absorbed in posters and I completely lost track of time. But I was interested in your mention of the University Mental Health Charter, and so quickly tried to look at what that's all about. And it strikes me as one of those frameworks that sets out a lot of important principles that universities should consider, but is sparse in detail about how to translate them into practice. And so one of the things I'm wondering is how you're going to translate it, but also how you're going to monitor whether or not the translation is successful, figure out what works, what doesn't work.
Well, just to kind of maybe add and make sure that everyone is aware of, that City is currently embarking on their Race Equality Charter journey as well, which is a charter mark in order to ensure that we are creating an inclusive and anti-racist institutional kind of experience in order to reduce any race inequalities. So very similar to the Race Equality Charter mark, there will be a set of principles that guide us, but then we would have, a team of representatives, leaders, students who would be a part of this group, and that's already has been developed, and they would be responsible for ensuring that those principles are carefully scrutinized, assessed, reflected on in order to make sure that it's fit for purpose within our institution based on our existing policies, processes, and structures. And then, like any of these charter marks, we would always have kind of administrative and managerial support in order to kind of ensure that it's embedded, but also that it's focused and targeting kind of the areas that we need to really change or tackle as a result of our existing kind of mental health understanding of our student and staff experiences.
Thank you.
Just say I'm a student assessor for the mental health charter. It's intentionally vague to serve, because there's so many different types of universities, there's not going to be a one-size-fits-all approach. So the goal is for the assessors and student minds to work with each institution to work out how best to implement those principles in individual institutions over the 5-year period with multiple visits and points for reflection. So that's why it seems a bit vague in terms of how you actually institute those principles, because it will be different everywhere we go.
I don't think there's anything wrong with principles being vague. I think my question is more about how you monitor whether or not the principles have been implemented successfully, so that there should be some sort of outcome monitoring. There should be something like, if it's working, then more students are accessing support.
So like the Race Equality Charter mark, the Athena Swan Charter mark will also have kind of project management over it, but then an action plan would be developed, and then that's where you would provide kind of the indicators for success, the outcomes that you want to meet, the timing, like you said, and thank you very much for sharing that insight with us, but also over the 5 years, how we're going to progress that and what do we